Have you ever seen some big scientific breakthrough in the news and thought, great, that should be a law now, only to see, well, nothing happen? Today, we are diving headfirst into that messy, super complicated, and, let's be honest, often frustrating world where solid evidence meets the reality of policymaking. And let me tell you, it is never a straight line. It really feels like it should be simple, right? You'd think good science would automatically lead to good policy. But the truth is, it's more like a winding, bumpy road full of political roadblocks and just unexpected detours. So why does the hard evidence so often get lost in translation? We all kind of have this ideal picture in our heads. A scientist in a lab has that aha moment, they publish their findings, and then a group of policymakers rationally takes that evidence and turns it into sensible rules for everyone's benefit. But this idea of a clean, straight path from the lab to the law, yeah, that's pretty much a myth. What really happens is more like a clash of two totally different worlds. You've got science, which is all about data, objectivity, and what can be proven. And then you have politics, which is driven by things like public opinion, ideology, and of course, getting reelected. And when these two worlds collide, the results can be, well, explosive. This quote right here from Professor David Nutt, it just cuts right to the heart of the whole conflict. This is a guy who was the UK government's chief drug advisor. I mean, his whole job was to make sure science was guiding policy. But his story is a perfect example of what happens when that scientific advice doesn't match the government's preferred message. So let's just walk through this. First, the government completely ignores the scientific advice from his team about cannabis. Then, Professor Nutt goes public and points out a simple, evidence-based fact that things like alcohol and tobacco are actually way more harmful than many illegal drugs. And the political fallout? He gets fired. Why? Because he was seen as undermining the government's tough-on-drugs message. It is a classic, textbook case of politics winning out over the evidence. But, it's not always some big, dramatic political fight. Sometimes absolutely life-saving evidence can just sit on a shelf, ignored for years, not because it's controversial, but just because of plain old inertia. I mean, take the absolutely tragic case of sudden infant death syndrome or cot death. Research from way back in the early 1980s showed a really simple, avoidable risk factor: putting babies to sleep on their stomachs. The evidence was right there, it was clear. And yet in so many countries, it took years for that information to become a real public health campaign telling parents to put their babies to sleep on their backs. So what finally broke the deadlock? What made the change happen? It wasn't more data, it wasn't another research paper, it was something called a focusing event. In this case, it was high-profile TV programs and media campaigns that finally grabbed the public's attention. That emotional connection did what years of research couldn't. It created the political will to actually do something. So the bottom line is, there are just so many hurdles. Like we saw with Professor Nutt, sometimes the findings are just too politically hot to handle. The cot death example shows us that research can challenge practices that professionals have been following for decades. Other times, the research might point to a huge, expensive policy change that governments just don't want to deal with. And sometimes it gets even messier, and the evidence itself gets attacked by questioning the scientists or who paid for their work. And, okay, we have to talk about the other huge player in this complex dance, the media. Because when it comes to shaping policy, public perception, which is almost always fueled by media coverage, can often shout way, way louder than any scientific consensus. Policy often ends up following the loudest voice, not necessarily the most accurate one. And this whole MMR vaccine scare is just a brilliant, if terrifying, illustration of that divide. On one side, you have overwhelming scientific evidence. We're talking systematic reviews, the gold standard, all showing there's no link between the vaccine and autism. But on the other side, a massive tidal wave of public fear, all kicked off by media coverage of one tiny, deeply flawed, and eventually retracted study. The result was chaos. Public anxiety went through the roof, vaccination rates dropped, and kids got sick from diseases that were totally preventable. And this chart just shows you how wild that mismatch is. You can see it right here. The media coverage for rare, scary-sounding diseases, super high, but the actual risk to the public from those things, extremely low. Meanwhile, the real public health threats, things like poor diet or alcohol, get way less attention. So of course, policy often ends up chasing the headlines, not the actual evidence of what's putting our health at risk. Okay, so this can all seem a little depressing. Is it just hopeless? Well, not necessarily. But bridging that gap between the research lab and the halls of government means we have to get past those simple myths and get real. We need a more strategic approach. Maybe the goal isn't evidence-based policy, which can be rigid, but something more like evidence-informed policy.
So how do we even begin to do that? First off, we just have to accept that it's complicated. Policy doesn't happen in a neat little bubble. It's a messy world of competing interests and values. Second, we need to support the intermediaries, the organizations whose job it is to translate dense, complex research into clear messages that policymakers and the rest of us can actually understand. And finally, we all need to get better at understanding risk and evidence, and that includes encouraging the media to be way more responsible in how it covers this stuff.
Which brings us to this final, really challenging question. When the hard evidence of science is pointing in one direction and the giant machine of policy is pointing in another, who are we supposed to trust? Look, there's no easy answer here, but just understanding the complicated dance between these two powerful forces, that's the first and maybe the most important step.